I will now go over the different types of results that you can receive when your BRCA genetic testing is done. If you choose to participate, you will receive your BRCA genetic test results in approximately 2 to 4 weeks from the time that Veritas Genetics receives your sample. Individuals who test positive for a BRCA mutation will be contacted by a genetic counselor from Women's College Hospital, while those who receive a negative or inconclusive result will receive a report from Veritas Genetics. You can get 3 possible results from this test. The result may be negative, positive, or a variant of uncertain significance. Most individuals will test negative, meaning no changes or mutations were found in the BRCA1 or BRCA2 genes tested. Although reassuring, this does not mean that you cannot develop cancer in your lifetime, and your cancer risks should be based on your personal and family history of cancer. Similarly, any cancer screening or prevention recommendations should be made based on your family history of cancer. Therefore, you may wish to speak with your family doctor or a genetic counselor to get more information about your negative test result and what this means in the context of your own personal and family history of cancer. A small proportion of individuals will test positive. Testing positive means that a change or mutation that causes the gene to stop working was found in either BRCA1 or BRCA2. This is not a diagnosis and does not mean that you will develop cancer. It does mean that you are at an increased risk to develop certain types of cancers, including breast, ovarian, or prostate cancer. Receiving a positive test result may mean that you benefit from screening that you were not previously eligible for. Additionally, you have options regarding risk-reducing management, like preventative surgeries or medications. A positive test result also means that other family members may be at risk, and therefore it is important information to share with them. This will allow them to make informed decisions about their own genetic testing, screening, and risk reduction. A positive result means that your first-degree relatives, like your parents, siblings, and children, each have a 50% chance to also have the same mutation. If family members are interested in genetic counseling, they may be referred by a healthcare provider to their local genetics clinic to further discuss testing as well as options to either catch cancer early or prevent a cancer from happening. Sometimes with genetic testing, we can get a variant of uncertain significance. This means a minor change was detected in the BRCA1 or BRCA2 genes, but it's not clear at this time whether this variation causes an increased risk of developing cancer in those who carry it, and if so, by how much. It may be that in the future, there will be more information and research about the specific variant identified. Since we all carry genetic changes in our genes, many variants identified are later reclassified as being harmless or benign, where there is little to no effect on cancer risk in individuals who carry this variant. However, they can sometimes be reclassified as being significant or cancer-causing. Since genetics is an ever-evolving field, we may know more in the future. Therefore, if you receive a variant of uncertain significance through your genetic testing, follow up with your healthcare provider or a genetic counselor for additional information and also recommendations for follow-up. So overall, what could this genetic testing mean for you? If you are found to carry a BRCA1 or BRCA2 mutation, i.e. that you test positive, this means that you're at increased risk of breast or other types of cancers. The level of risk depends on many factors, such as your age and also your personal medical history. Your genetic testing results can help you make decisions about your health. You and your family doctor can use this information to discuss and decide on the best management options for you.